Morning, everybody. So we thought it would be nice to start out explaining how we actually got here as a national centre. The National Aspergillosis Centre was formed on the 1st of April 2009 and opened its doors on the first time for patients on the 1st of May. So it was very exciting times for us. It's a unique service. So we got there by Professor Denning. He was a doctor at the time, arrived from North Manchester, and he had an interest in rare fungal diseases and had seen a small group of patients at North Manchester. He moved across to Wythenshawe as a senior lecturer at the time and decided to set up a small clinic with the focus on chronic pulmonary aspergillosis. And a number of referrals increased during that time, and along with it came other fungal diseases such as allergic bronchopulmonary aspergillosis, severe asthma with fungal sensitization, and aspergillus bronchitis was just starting to reveal itself. So why set up a service? So it became apparent that it was very specialised, and so we decided it needed a little bit more of specialist care. Also, it would broaden our knowledge and we would get better funding, access to expensive antifungal drugs for certain disease groups. At the time, the antifungals were incredibly expensive, so access to that was crucial for these patients. The more people referred, the better our experience and ability to care for the patients with Aspergillus disease, and the better the service offered nationally. In addition, it would allow us more research, and from the research, the treatment and diagnostics would improve. So how do we set up the service? So we applied to the Department of Health for specialist funding from the National Commissioning Group to set up a specialist service back in 2008. And to do this successfully, we had to make out a convincing case that such a centre was going to be worth the cost. So we needed to improve the level of care. We needed to learn more about the diagnosis and treatment, and the patients would benefit. Cases tend to be very complex and needed specialists to provide the best care. There were very few clinical experts available at that time, so it was a good opportunity to train. Drug package and costs care were very expensive. So, with all that information put forward, on the 9th of October, our application was granted and the bid was signed off by government ministers. And the 1st of April 2009, funding became available. And then in May 2009, the National Aspergillosis Centre was officially opened. So, the team. Back then, we started with David Denning, who wasn't a professor, myself, and Graham Atherton. And that was about it, I'm afraid. But then we slowly grew. Professor Denning has now retired, and our team is led by Dr. Caroline Baxter. We now have 6 consultants, 5 specialist nurses, and 2 specialist physiotherapists, and 7 clinical fellows. So we've definitely grown. We work closely with the Regional Mycology Reference Laboratory and specialist diagnostics by Dr. Rena Richardson, Professor Malcolm Richardson, and Caroline Moore and their team. And all our samples go through that laboratory. It's vitally important that that link is there. So we also created a support group. We felt it was important with such a rare disease and so complex that it was important patients had somewhere to go to be able to talk and meet together and share their experience, and also to support the carers, because we mustn't forget that they're dealing with this day to day as well. So we created a support group, and we acknowledge that patients are essential to our learning process, and support is essential to the best outcomes for the patient and the carer. Meetings are held every month to share the information and provide an opportunity for patients and carers to meet with others with similar experiences. This used to be face-to-face. We used to have sandwiches and tea and meet together. Of course, pandemic has changed all that, and it's probably better in some respects for people. So our meetings held on the first Friday of every month via Zoom, and we provide information, regular updates about disease and drugs, and the opportunity to share stories. So the meetings are currently viewable live online on Zoom, as I say, due to COVID restrictions. Approximately 8 to 12 people a month view the meetings live. 200 to 300 a month view the recordings, and we may return face-to-face meetings in the future. Recordings of our meetings are made available via video, and we've occasionally taken the patient meetings outside of NAC. In the past, we've visited places such as Rome. We held a patient meeting there, Edinburgh in October 2010, and London June 2011. We visited the Manchester Literature Festival, October 2013, and the AAA meeting, which is every 2 years, and it's on this year, tomorrow it starts. But our 7th one actually held in Manchester, which was a great opportunity for our patients. And in the last one was Lisbon 2018. Obviously, the meeting this year is virtual. So, our achievements. We set up a home care delivery service for patients all over the country, so that was allowing their drugs to be delivered to the home, which obviously was extremely helpful for patients, so they didn't have to come and collect drugs. Appointments available now and attend anywhere, over the phone or face-to-face if required, and that reduces the need for some of the visits. And we also set up a postal blood service. Again, our patients need a lot of monitoring on drugs and regular blood tests, so that reduced clinic visits for those tests, and that's proved to be invaluable during the COVID pandemic. We hold regular MDTs to improve clinical management and outcomes, both internally and externally. And in addition, they provide an excellent learning platform for doctors in the team, nurses, contact radiologists, so quite a broad group there. Our doctors provide advice and guidance for patients who cannot attend, and we have excellent support provided by our nurses to the patients, the GPs and the consultants. So, original research papers published at a rate of 60 to 70 per year, 2018, 2019, 2020. And these include better diagnostics, better use of antifungal drugs, new antifungal drugs, clear demonstrations of the benefits of treating aspergillosis, antifungals, including ABPA and CPA, establishment of a validated, rapid, accurate technique to estimate patients' quality of life and how this changes over time, which helps the doctors treat more appropriately, describing and fighting drug resistance, and describing new types of infection, Aspergillus bronchitis being one of them. We present numerous posters at international conferences every year. We play a major part in the running of major international conference called Advances Against Aspergillosis and Mucormycosis, mentioned earlier, and there are some posters out this year. These posters cover all aspects of our work and serve to reinforce our influence, increasing awareness and hopefully convincing more doctors throughout the world that aspergillosis deserves active management and care. So the future of NAC. The National Commissioning Group continue to support our service because we offer excellent care package for chronically ill patients around the country, advice for doctors around the country if patients cannot reach us, access to high-cost drugs and IVs, new scientific research ongoing, and the continuous learning for medical staff laboratory staff, nurses, students, and especially patients and carers. And that's how we got here. Thank you for listening.